Student, good day. Now we start the lectures. Topic of the tumor, and I'm going to introduce this topic. And in future, you will have study this topic on the third course, fourth course, and fifth course. And now I'm going to introduce this topic. What is a tumor? A tumor, also known as a neoplasm, is an abnormal mass of tissue that may be solid or fluid filled. In this slide you can see this tumor. Student, types of tumors. In general, tumors are divided into three groups. It's following groups. Benign tumor. These are not cancerous and cannot spread. A benign tumor will remain in its current form. They do not generally return after benign removed. And pre-malignant. Pre-malignant tumor and pre-malignant disease is not yet cancerous, but appears to be developing the properties of cancer. And malignant tumor are cancerous. They can grow, spread, and get worse. Student, in this table, you can see the difference between the benign and malignant tumor. Benign and malignant tumor are different in four important aspects. They are best summed up in a table. And you can see characteristic of this tumor. The fourth characteristic, differentiation and anaplasia, rate of growth, and local invasion and metastasis. Student, how to difference between the benign tumor and malignant tumor? The first aspect it's differentiation or anaplasia. Benign tumor, cells of benign tumor well differentiated. Cells resemble normal cells. Malignant tumor, variable differentiation from well differentiated to undifferentiated. Undifferentiated is anaplastic cells. Next aspect, it's rate of growth. Commonly, a benign tumor slow and progressive. Mitotic figures are rare and normal. Malignant tumor, erratic, can be slow or fast. Mitotic figures are numerous and can be abnormal. Хорошо. Student, next aspect, it's a local invasion. Expansile border, a benign tumor has the expansile border, well circumscribed tumor, and tumor often has a capsula. The malignant tumor, hard to circumscribe, infiltrative border, usually no capsula. Malignant tumor, different from the benign tumor, no capsula, have not capsula. And next aspect, it's metastasis. Benign tumor have not, never have metastasis, but malignant tumor very often this metastasis, frequently. Student, in this slide, you can see the figure showing the difference between the benign tumor on the left side and malignant tumor on the right side. And now I show you. Now, for example, in the slide you can see the uterus, fallopian tube, in here, fallopian tube, ovary, in here, ovary, and vagina. And on the left side, you can see the benign tumor. This benign tumor has a small size, well demarcated, have the capsula in here. This tumor have slow growing. This tumor non-invasive, non-metastatic, well differentiated of the cells. Well differentiated you can see in these pictures. It's a tumor called as a leiomyoma, and on histology pictures you can see the well differentiated all cells in here. All cells in here, it's the same. And on the right side you can see the malignant tumor. This malignant tumor in uteri called as a leiomyosarcoma. And on the difference between the benign tumor, malignant tumor has a large size in here, poorly demarcated. This tumor have not capsula. This tumor has a rapidly growing with hemorrhage and necrosis. Hemorrhage, you can see inside this tumor, you can see the hemorrhage and necrosis. This tumor has a locally invasive. This tumor has the metastatics and poorly differentiated. On these pictures, you can see some cells of this malignant tumor, and cells of this different from these pictures. These cells have poorly differentiated and differentiated all cells. It's signs of the difference between the benign and the malignant tumor. Okay, student, a tumor have the different type of the growing. The malignant tumor have the expansive growing, and malignant tumor have infiltrative growing. And in these pictures you can see this difference between these two types of the growing this tumor. Okay, on the slide you can see the benign tumor. Most benign tumors are not harmful to human health. However, even though they are not cancerous, some may press against nerves or blood vessels and cause pain or other negative effects. Benign tumors of endocrine tissue may result in excessive production of some hormones. And for example, I tell you about the benign tumor of thyroid glands. If your thyroid glands have the benign tumor, this tumor have excessive production of hormone thyroid glands. And this patient has the other effects of this. Student, now I tell you about the type of benign tumor. The first type of benign tumor is adenomas. Adenomas are tumors that arise from glandular epithelial tissue. The thin membrane that cover glands, organs, and other structure in the body. A polyp in the colon is a type of adenoma. And now you can see the other examples of this benign tumor. Now, for example, parathyroid adenoma, eosinophilic adenoma, basophilic adenoma, bile duct adenoma, chromophobe adenoma, fibra adenoma, and hepatic adenoma. Adenomas do not start as cancers. However, they can change and become cancerous, taking the form of adenocarcinomas. If your adenoma becomes a malignant tumor, it's called as adenocarcinomas. And this you can see the prostate with the urinary tracts, and in these pictures you can see the adenomas of prostate. Adenoma of prostate. It's very commonly disease for the older patients. The male patients. It's adenoma of prostate. Okay, student, the next type of benign tumor, it's wart. A wart caused by human papilloma virus. And in these pictures you can see the structure of the skin, and you can see the epidermis in here of the skin, and if your epithelial cells get the human papilloma virus, it's becomes warts. And on next slide, you can see this in really pictures of this papilloma. It's epithelial adenoma. You can see on the lips, adenoma of the lip, papilloma of the lips, and the skin. Here. Next type of benign tumor is fibroids, all fibromas. Fibroids are a benign tumor that can grow on the fibrous or connective tissue of any organs. Uterine fibroids are common and can cause vaginal bleeding, pelvic pain, or discomfort, and urinary incontinence. They can be soft or hard, depending on the proportion of fibrous to cells. There are many types of fibroma, including angiofibroma, dermatofibroma, and osteophying and non-osteophying fibroma. Some fibromas can cause symptoms and may require surgical removal. In rare cases, fibroids can change and eventually become cancerous. Now, for example, in the slide you can see the fibromas of the uterus. Fibroma of the uterus. Student, next type of benign tumor is hemangiomas. Hemangiomas are benign tumors that consist of excessive blood cells. Then they can sometimes be seen on the surface of the skin and are known as the strawberry marks. The majority of hemangiomas appear at birth and gradually go away after some months or all years. Hemangiomas do not usually require any treatment. If they affect the ability of an individual to eat, hear, or see, the doctor may recommend treatment with corticosteroids. If the patient is over the 10 years of age, they are more commonly removed using laser surgery. And in this slide you can see this hemangioma on the skin. Hemangioma on the skin. Okay, next type of the benign tumor is lipomas. Lipomas are the most common form of soft tissue tumor. They consist of fat cells. Most of them are very small, painless, soft to the touch, and generally movable. They are more common among people aged over the 40 years. Experts disagree and whether lipomas can change and become cancerous, but it's very rare. There is a range of lipomas including angiolipoma, myelolipoma, fibrolipoma, spindle cell lipoma, hibernoma, and atypical lipoma. It's type of benign tumor lipomas. Student, in this in this slide you can see the lipomas. In the fat tissue under the skin, and it's benign tumor. If your lipomas have the small size, this patient don't need to remove these lipomas. But if your patient have the large size of lipomas, and maybe these lipomas affect the joint and other moveous organs, this patient need to remove these lipomas. Student, next type of the tumor of the disease is pre-malignant tumor and the pre-malignant disease. The type of tumor requires close monitoring. Example of the pre-malignant growths include at the first place, actinic keratosis. Actinic keratosis, also known as senile keratosis and solar keratosis. This is a premalignant growth consisting of patches of the skin that turn crusty, scaly, and thick. Fair-skinned people are more at risk of developing this type of growth, especially those who are overexposed to sunlight. Actinic keratosis are seen as a potentially premalignant because around 20% of them progress to squamous cell carcinoma. Doctors usually recommended treating them because of this. Continuous exposures of the sun increase the risk of malignancy. And in this slide you can see the actinic keratosis. Actinic keratosis. Okay, next type of premalignant tumor is cervical dysplasia, cervical of the uterus, cervical dysplasia. This is a change in the normal cells lining the serous. The growth can be premalignant and is at risk of developing into cervical cancer. Cervical dysplasia is diagnosed with the PAP smear. It is most common in women age from the 25 to 35 years and may be removed with the freezing techniques, all by removing the cone of tissue from the cervix. And in this slide you can see cervical dysplasia. Cervical dysplasia. It's cervical of uterine, and we can see the cervical dysplasia. And the second pictures you can see the histology pictures of the cells. Cervical dysplasia, it's premalignant disease, premalignant tumor. Student, next type of premalignant tumor, it's metaplasia of the lung. This growth occurs in the tubes that carry air from the windpipe into the lung, all the bronchi. The bronchi are lined with glandular cells, which can change and become squamous. And in this slide you can see this metaplasia of the lung. Metaplasia of the lung. And next type of premalignant tumor, premalignant disease, it's leukoplakia. You can see the mouth, and you can see the leukoplakia in here. It's two dysplasia of the cells, and it's premalignant disease. Leukoplakia is thick. White patches can form on the gum, the bottom of the mouth, the inside of the cheeks, and less commonly on the tongue. They cannot be scripted off easily. Experts believe smoking or chewing tobacco is the main cause. Although leukoplakia is rarely dangerous, A small percentage can eventually become cancerous. Many most cancers occurs near areas of the lake Plekia. The condition usually clears up when people quit smoking. Quitting both alcohol and tobacco together has better results. The patches can be removed using a laser, a scalpel, or cold probe that freezes the cancer cells. Okay, and next we describe the malignant tumor. Malignant tumor is very dangerous. Malignant tumors divided and spread rapidly, colonizing new areas. Malignant tumor are cancerous tumor that can potentially result in death. Unlike benign tumor, malignant ones grows quickly. It can spread to new territory in process known as a metastasis. The abnormal cells that form a malignant tumor multiply at a faster rate. The cancer cells that metastasis are the same as the original ones. If a lung cancer spread to the liver, the cancer cells now growing in the liver are still lung cancer cells. They have, however, acquired the ability to invade other organs. Different types of malignant tumor are made up of specific types of cancer cells, including in the slide you can see the cancer of the stomach. Student, and you can see the the first pictures. It's X-ray research of the stomach, and on this X-ray research we can see the tumor inside the stomach. And in second pictures you can see the fibrogastroscopy. The method of exam, it's better method of exam the stomach, esophagus, stomach, and intestine. And in these pictures you can see the cancer of the stomach. Cancer of the stomach. It's very large cancer, very large tumor. And this tumor need to surgery. All malignant tumor need to surgery. Okay. Next type of malignant tumor is carcinoma. These tumors are formed from the epithelial cells. For example, carcinomas can occur in the stomach, prostate, pancreas, lung, liver, colon, or breast. Many of the most common tumors are carcinomas, especially among older adults. And this you can see the carcinoma, epithelial carcinoma, from the epithelial cells. Okay, next type of malignant tumor called as a sarcoma. This tumor start in connective tissue such as cartilage, bones, fat, and nervous tissue. They originate in the cells outside the bone marrow. The majority of sarcomas are malignant. And in this slide you can see the sarcoma of Kaposi sarcoma in here. Next type of malignant tumor, it's germ cells tumor. These are tumor made from the cells that give life, sperm and egg cells. Germ cell tumors most commonly occur in the ovaries of testicles. The majority of testicular tumors start from the germ cells. Less commonly, germ cells tumor may also appear in the brain, abdomen, or chest. In this slide you can see the organs with the germ cells. Ovaries, you can see ovaries in here, and testicles. Student, next type of malignant tumor called as a blastoma. Tumors formed from embryonic tissue or developing cells are known as blastomas and are more common in children than adults. Examples include medulloblastoma and glioblastoma, a type of brain tumor, retinoblastoma, a tumor in the retina of the eyes, osteoblastoma, a type of bone tumor, and neuroblastoma, a tumor of nervous systems found in children. In this slide you can see the blastoma, glioblastoma, inside the brain, glioblastoma, and this blastoma of the bone. Student, and now I tell you about TNM classification. TNM classification is very important classification for the malignant tumor, and this TNM classification helping us to make diagnosis of malignant tumor. The TNM classification of malignant tumor is a globally recognized standard for classifying to extent of spread of cancer. It is a classification system of the anatomical extent of tumor cancer. It has gained wide international acceptance for many solid tumor cancers, but is not applicable to leukemia and tumor of the central nervous system. Most common tumors have their own TNM classification. And now I show you TNM classification is a notation system that describes the stage of the cancer, which originates from a solid tumor using alphanumeric codes. What is it? Letter T. Letter T describes the size of original primary tumors and whether it has invaded nuclear tissue. N, letter N, describes the nearby regional lymph nodes that are involved. And letter M describes distance metastasis, spread of cancer from one part of the body to another. In the slide we can see the first characteristic of TNM classification, later T. Later T can be next type TX, T in situ, the first TX, T in situ, to 0, and to first, to second, to third, to fourth. Its size of this tumor, in these pictures you can see this. You can see. Now, for example, its stomach, its follow organs, which have the mucus and submucous layers, muscles, tissue, and fat tissue. And TX tumor which invisible. T in situ, like this, T in situ, in here. Carcinoma in situ. And next we have the T0, no evidence of the tumor, and T first, T second, T third, and T fourth, it's other size of this tumor. T first affected the mucous and submucous layers. T seconds affected mucous, submucous layers and muscles layers. T third affected the mucous, submucous and muscles layers. And the no, for example, peritoneum tissue. And the fourth, it's very large tumors, affect all layers of the follow organs. Later T characterize the size of the tumor. Next, later N describe neighboring lymph nodes that are involved, and to divide it on next groups. N0, no regional lymph nodes metastasis, and the first regional lymph node metastasis present at same sites. Tumor spread to closest all small numbers of regional lymph nodes. N seconds, tumor spread to an extent between the N first and N3. And N3, tumor spread to more distant all numerous regional lymph nodes. Next, later M. Later M mean present of distance metastasis, and divided two groups. M0, no distance metastasis, and M first, metastasis to distant organs beyond regional lymph nodes. Student, and we will have the other parameters of malignant tumors, like this. Other organs can behave other classification of malignant tumor, and in the slide you can see the classification of gastric tumors, and you can see the two same aspects: the TNM classification. T, its size of the tumor, N, the characteristic of the affected nodes, lymphatic nodes, and M, its distance metastasis. Student, the development of the malignant tumor include four stage. Now I am described the TNM classification, and now I explain why this classification help us to make this diagnosis. Development of the malignant tumors include four stages. The first stage, characterized by small dimensions of the oncological focals, the absence of its germinations into nearby organs. In addition, there is no lesion of lymphatic system. The second stage, the focus is already clearly defined within the boundaries of the initial localization. There may be a single metastasis lesion of the lymph node stage. Student, the first and second stage are called as a operable stage. What does it mean? If we have the patient with first and second stage, it's operable stage. This patient need to surgery, and the results of the surgery are successful. When we remove this tumor with the first stage, with the second stage, the results of this remove this tumor are successful. The third stage, the oncological focal grows into the near tissue structures. There is a multiply metastatic lesion of the lymphatic system stage, and this stage called as a doubtful operable stage. Why? This stage patient with this stage, the third stage, need to accept the surgical. This patient need to the chemical and radiotherapy. And fourth stage of malignant tumor, metastasis spread through the lymph nodes throughout the body and affected both nearby and distant organs. The fourth stage are called as an inoperable stage. This patient need to only syndromal treatment, and this patient need to surgery only when they have a complication of the malignant tumor. But radical surgery we don't perform. And next slide, you can see the how to define the stage of this, and you can see on this slide stage grouping. And now I tell you about the stage 1, stage 2, and in the slide you can see what is the stage 1. Stage 1 have the T first, tumor first size, nodes 0, those original nodes don't affect the metastasis. And first stage have not organs metastasis. You can see in the slide M0. And second stage can be have the size of the tumor T second, T third, N nodes, affected of nodes, lymphatic nodes, the first and 0. It's second stage. And this patient have not organs metastasis. It's second stage. And this patient with the first and patient with the second stage of malignant tumor need to surgery. And commonly results of this surgery for remove this tumor can be sexful. Student, and then you can see the stage, third stage, third A, third B stage. What is it? Third stage has the size of the tumor can be second size, can be third size, can be fourth size. It's no middle size of this tumor. And this patient can behave the nodes second, nodes 1, nodes seconds, affected of regional nodes, lymphatic nodes. And this patient with third stage cannot have organs metastasis, cannot have. You can see in this M0. It's third stage. But these patients need to surgery and need to complex treatment of the chemical therapy and radiological therapy. And fourth stage is a very dangerous stage of malignant tumor. This stage called as an inoperable stage. And this patient have the metastasis, organs metastasis. And this patient need to surgery only if this patient have the complication of the tumor. Okay, so now wait for me 1 minute, okay? And I continue. Okay, student, next topic of our lectures is wounds and wounds process. Wounds are called mechanical damage of the body body tissue, accompanied by a violation of the integrity of the skin or mucous membranes. Some authors share the concept of the wounds and wounds, but these concepts have only languagist difference. Student, at the first, I tell you about the anatomy classification of the wounds and anatomy structure of the wounds. The wounds divided three groups of the wounds. Through wounds, these wounds have the, for example, it's the first pictures, through wounds. When the traumatic agents have the entrance hole and have the exit hole, entrance hole in here, exit holes in here. It's through wounds. The second type of the wounds is blind wounds, like this, like the second pictures. And you can see these blind wounds have only input, entrance holes, and have not exit holes. And third type of the wounds, wounds can be tangent. Wounds have edges, walls, bottom, and contents destroyed tissue, foraging bodies, blood, exudate. If the wounds are deep and narrow, stab, gunshot wounds, then the edge and the walls form a wounds channel. And tangent wounds you can see on the third pictures. Okay, it's three types of anatomic classification of the wounds. Through wounds, blind wounds, and tangent wounds. The main local signs of the wound, its clinical symptoms. And you must remember, the wounds have the clinical symptoms. It's pain, bleeding, and gaping. In this slide you can see the symptoms. Pain. If you touch these wounds, the patient feels the pain. Patient with the wounds have the bleeding. You can see in here, bleeding, and gaping. Gaping, it's a spread of the wound. The severity of these symptoms depends on the origin and nature of the wounds. The main common signs and complication of wounds are bleeding, shock, anemia, and infection. But at the first, patient have the three clinical symptoms: pain, bleeding, and gaping of the wounds. And then, depending of wounds process, can be complication of the wounds. Bleeding, shock, when the patient has a very large blood loss. This patient have shock, anemia, and after the 5 days can be infection inside the wounds. It's main symptoms of the wounds. Depending on the nature of the wounding agents and the structure of the wounds itself, they are divided into can be cut wounds, chopped wounds, stabbed wounds, brushed, smashed wounds, torn wounds, beaten wounds, firearms, bullet, shrapnel, a shot caused by a ball, and erode projectiles. Ins other type of the wounds, depending on the nature of the wounding agents and the structure of the wound. Torn wounds occur when the grabbing the skin and tissue like a hook, with the formation of defects in the skin, all its flaps. Scalpel wounds. These wounds are not accompanied by large bleeding, but significantly painful. A free torn tissue site should be delivered to the hospital with the injured, and it, if possible, should be implanted or reimplanted. Now we can see the chopped wounds. Chopped wounds are inflicted with an axe, saber, and other sharp but heavy objects. The edges of these wounds are uneven, crushed and accompanied by damage to nearby and deep lying tissue. Signs such wounds are applied with the application of the ledge force. They are deeper and are often accompanied by damage to the bones. Bleeding is plentiful, but it quickly stops. Since the impact occurs and the crushing of tissue, including blood vessels with the wrapping of intima and their lamen. In addition, a large amount of tissue, thromboplastin, is released from damaged tissue, which activates blood clotting. The pain here is severe due to significant damage to the tissues in around the wounds. Gunshot wounds. With the gunshot wounds, there are three zones. The area of the wound defect, primary wound canal, filled with the blood clots and wound discharge. There are free aligned tissue fragments, foreign bodies, zone of primary traumatic necrosis. Occurs under the influence of the kinetic energy transmitting from the bullet to the tissue. It contains non-viable and partially non-viable tissue soaked in blood. The zone of molecular tissue concussions is located outside of the zone of primary necrosis. In this zone, the tissue retain their structure. However, their vital activity is sharply disrupted. Some tissues are in state of reduced vital activity, necrobiosis. In some tissues, small foci of necrosis developed. The future fate of the tissue in this zone depends on the subsequent condition of their existence. In this case of an unfavorable cause due to circulatory disorders and progressive disorders of this trophic tissue can die. A zone of secondary necrosis is formed. Student, in the slide you can see the stab wounds. The stab wounds are inflicted with bayonet, nails, awl, repair, stick. The wounds canal here is deep with a small external wounds. The surrounding tissue are squeezed and damaged the more of thicker the percent object. From the appearance of the wound, it is difficult to judge the depth and direction of this wound channel. The peculiarity of these wounds is deep penetration with damage to the walls of cavities and penetration into them. Can be abdomen, chest, skull, spinal canal and joint, with damage to vital organs and the blood vessels, as well as the introduction of the infection into the underlying tissue. As you can see, the stab wounds in here and very deep wounds. The skin, subcutaneous tissue, muscles tissue, and then we penetrated to the cavity, to the internal cavity. Next type of the wounds is beaten wounds. Beaten wounds are inflicted by wild or domestic animals. For example, dogs, cat, foxes, wolves, horses, pig, snakes, and sometimes was human. More often, the hands, fingers, foot, and lower leg suffer. Characteristic of these wounds are traces of this crushing, sometimes rigid edges, infection, including anaerobic infection, tetanus infection, as well as rabies and benign lymphoreticulosis. Cat scratch disease and rat bite, Sudoku disease, caused by chlamydias, the carriers of the which are rodents that infect animals that hunt them. And this you can see on this slide. You can see the beaten wounds in here. And next, I tell you about the wound healing. Wound healing have the 4 stages. The first stage is a stage of hemostasis. When the patient gets the wounds, gets the trauma, gets the wounds, at the first stage is hemostasis, and inside the wounds we produce the blood clot. Next stage of wounds healing, it's stage of inflammatory. In this site activates process of immunological response, and this state inflammatory. Inflammatory, depending on the wounds agents and enters of bacteria inside the wounds. Third stage, proliferative stage. Proliferative states each stage of the start of recover these wounds. And fourth stage, it's proliferative third stage. And fourth stage is stage of remodeling. A stage of remodeling and recover the wounds. Okay, student, today we are finished our lectures and continue on the after next week. Continue these lectures and at the finish I must to tell you, student, the second course, you will have the project practice now, and I ask you, you open your portal with this practice, project practice. On this portal we did post the task for you, and you need to perform this task. Open the portal with the project practice and will perform this task. Okay, today it's goodbye.